This segment of Delmarva Life is brought to you by Delmarva Dental Services.
We just celebrated Mother's Day, and what's not to celebrate? Raising a child is not easy.
Oh no, it's not. The unconditional love and sacrifice moms are so famous for begins months before childbirth, 9 to be exact. In fact, when the body goes into that baby building mode, mom's health care can become secondary. Sometimes that includes dental health, and that's why the team at Delmarva Dental Services want to be sure all moms to be know what to expect when they're expecting the dental edition. Doctors Irene Sakelis and Jessica Harrison of Delmarva Dental Services know firsthand about pregnancy and dental care.
There's a few things that can happen when you're pregnant.
Both are weeks away from giving birth. They say there's a lot going on in a woman's body when they're pregnant.
A lot of inflammation, a lot of hormones going on, so of course your gums and your teeth are also going to feel it, right?
Hormonal changes can make a woman's gums more vulnerable to plaque, which can cause gingivitis,
Which is just kind of inflammation and some swelling, redness of the gums. It can cause increased bleeding, discomfort, sensitivity. It's really uncomfortable.
An excessive amount of inflammation in one spot is called a pathogenic granuloma.
It doesn't necessarily hurt, but it is a little uncomfortable and bothersome to the mom.
It kind of resembles an abscess, so it can worry, mom and the patient. So it's important to make sure that you go to the dentist and have good oral hygiene while you're pregnant.
Daily oral and dental care is especially important for the health of mom and baby.
We want moms to brush twice a day for at least 2 minutes, flossing at least once a day, rinsing with either a fluoride mouth rinse and brushing with a fluoride toothpaste. That fluoride's going to help kind of strengthen that enamel that can be kind of broken down, if mom is sick during the first trimester.
What we recommend is be established with a dentist. If you don't have a dentist, now's the time to get one. Making sure that you are taking care of your teeth by going for your routine dental cares every 6 months for your nice cleaning, making sure you're brushing, flossing, using a fluoride toothpaste at home, trying to keep everything as healthy and clean as possible.
If you do have a dental issue, it's important to get it taken care of.
Yeah, so it could happen, right? It could happen to all of us. So needing a filling. Or anything more, like even, oh my gosh, I broke a tooth, or now I have a toothache. I need a root canal or an extraction. It's totally safe and normal to have that.
It is actually very safe to get work done while you're pregnant. The medications that we use, the numbing medicine, if we have to do antibiotics, that's safe to give during pregnancy for mom and baby.
Dr. Harrison does say your dentist should avoid using nitrous or any kinds of depressant drugs. So what about x-rays? That's a question both doctors get from moms-to-be on a regular basis. X-rays
are safe during pregnancy. We always put a lead apron on our patients. Sometimes moms prefer to wear 2 lead aprons. The amount of radiation that you get during these x-rays is so minimal. So it's very safe during pregnancy.
Dr. Harrison goes on to say if mom is concerned, it's not always necessary to take a full set of x-rays, especially if they have good hygiene and have been getting regular cleanings.
We can just take a localized single x-ray and determine, the risk versus the benefit of fixing that area versus letting it go.
Once baby is born, oral care for 2 continues.
So baby's here. Mom is now trying to figure it all out and make it work, right? So if you're breastfeeding, fantastic. Breastfeeding is supposed to help baby with their latch, and their latch will also help development. There's studies out there that say that you might not need braces if you breastfeed. Hey, that's kind of great.
If your dentist needs to prescribe an antibiotic or pain medication, be sure and let them know you're breastfeeding. Something else that could cause adverse effects to a newborn: bacteria in mom's mouth.
The bacteria, good and bad, in our mouths are not the same bacteria that baby has in their mouth. Normal floral bacteria that we have in our mouth can cause a lot of issues to a baby. So just being mindful. Avoid kissing on the lips. Avoid licking their pacifier if it falls on the floor to sterilize it and give to them.
And both doctors say it's important to clean babies' gums and teeth when they arrive in order to prevent problems with adult teeth later in life. Doctors Harrison and Sakella stress that if you're pregnant and have not had regular dental care, it's important to make an appointment. There are links between periodontitis, which is a serious gum infection, and preterm birth, low birth weight babies. And there's also the danger that you could develop preeclampsia, which can be dangerous for both baby and mom. And of course, all the doctors at Delmarva Dental Services are very comfortable treating patients who are pregnant.
I didn't know all that went into it.
Oh yeah. Oh yeah.